Tired of the conflicting advice in the world of health and wellness? Ready for clear, science-backed strategies to live a longer, healthier life? Welcome to the Duration Wellness Show. We focus on health and wellness education to help you become a better, more informed you. Wherever you are on your journey, we're here with you for the duration.
Welcome to the Duration Wellness Podcast. We are here for another episode that we're going to talk all about supplements, which I am so excited for this episode. And basically, I think we love supplements. Obviously, at Duration Wellness, we've developed our own supplement. But have you ever stopped and thought about what actually goes into supplements? Like what you're actually taking? Not just the ingredients listed on the label, but how they're sourced, how they're tested, and who's verifying what's promised is actually inside. Because here's the reality. Supplements aren't regulated like prescription drugs. They don't go through the same approval process. So if that's the case, how do we know what we're taking is actually what it says that we should be taking? When a label says 1,000 milligrams, is it really 1,000 milligrams? When it says third-party tested for what exactly? So today we're unpacking what actually goes on behind the scenes, how supplements are engineered, how they're tested, what certifications really guarantee, and what you as a consumer should actually be paying attention to. So today, I'm so excited to introduce our guest, Montana. So he's a biosystems engineer, and he has experience in how supplements are actually made, bringing a practical perspective on the systems, process, and manufacturing behind the products people use every day. And he's also near and dear to my heart because he's my husband. So this is Montana Wells. Welcome.
Welcome. Thank you very much. Glad to be here. So as you guys know, I am Anna Marie's husband, but my name is Montana Wells. A little bit about myself. I am the actually co-owner and one of the founders of Duration Wellness, which is a company focused on providing quality and scientifically informed supplements that support a healthy lifestyle. So I'm originally from Oklahoma. I graduated Oklahoma State with a degree in biosystems engineering. My focus was in food and bioprocess. So a lot of my professional background is actually in especially food and beverage manufacturing, and then specifically doing engineering roles or design roles where I would be designing food processing systems for different clients, selecting equipment, integrating them together, making sure they work correctly, and are providing the quality food that the client is trying to produce to their specifications and within compliance to all kind of like FDA regulations on food safety and stuff. So a lot of it has been around, especially just maintaining, not only selecting, designing food safe systems, but working to get the everything quality and experience on that side of things. With Duration Wellness, I am serving as the lead person, kind of vetting, as well as researching our strategic manufacturing partners or testing partners, as well as really kind of diving into a lot of the regulatory requirements involved as a brand, as a firm, who is looking to manufacture supplements for consumers to take and distribute. So there's a lot that goes into that part of the kind of requirements and what the FDA looks for and is kind of vetting out as firms, release these products. So it's fun, kind of like a different part of my career that I've been doing. I'm familiar enough with, especially on the food side and beverage side, of a lot of these requirements. So this is a little different for me. It's been fun.
Yeah. And it's exciting. And I'm really excited about this episode too, because I think, in the supplements realm, a lot of people don't understand, the labeling and what they actually should be looking for. So I think this is going to be really fun to talk about.
Right.
Yeah. So let's get into it. I think there's a lot of confusion and questions, about how supplements are actually regulated. And also, I think, a lot of people will talk about how they're not as heavily regulated as pharmaceuticals.
Yes, exactly.
And, why is that the case?
Yeah. So you are absolutely correct. They are not as regulated as pharmaceuticals. And depending on who you talk to, some people definitely think they should be. That's kind of just how it is. But a lot of the history behind how supplements specifically are been regulated, it starts back kind of at the turn of the century, back in like the 1900s, like the early 1900s, late 1800s. That's when the government, specifically the federal government, really started getting more involved in how our food was made. Some food safety and standards and regulations. I think it was the Pure Food Act, like in the early 1900s, like 1908 or something like that. That could be kind of wrong. But that was kind of one of the first big pieces of legislation that formed the FDA and the Department of Human Services. So like back then, that's when it really started to kick off. There was a lot of kind of issues popping up, especially between the states and manufacturers, where we get adulterated food, lots of poisonings. There was actually several cases that usually that's what kind of started all of this from the regulatory side. And even from that point on, the regulations and the laws that govern them end up getting stacked onto each other, and it's amended over the last century or so. There's been a lot of different amendments. Kind of one of the bigger ones is, I believe, the Pure Food and it's the Food, Drug, and Cosmetics Act. Late 1930s, there was a bunch of issues kind of around basically elixirs and different products causing mass poisonings. Like I think there was a case in the late 30s where unfortunately like hundreds of people died because of the poisoning issues. And that really, before then, there was some effort to kind of get more of this regulation in place, and the FDA was kind of pushing it even back then. But that was kind of the big catalyst that got it done. And so that really set the standard or the beginning of regulating all food, drugs, cosmetics, and even starting some medical devices.
Interesting. Yeah. I mean, it actually makes sense because, like, if you think about back then, elixirs were kind of all that people had. Like, penicillin really came out like late 1920s, but like in terms of like mass produced, it wasn't until 1940. So around then, it's like an elixir was all people had. Even then, it's like
you bring up penicillin. I think there was even some concerns and issues with making sure penicillin was manufactured properly, because then you might get, if you like your drug or your medicine, your pharmaceutical wasn't manufactured safely or properly, you can then take it, it's supposed to cure you, it actually kills you. So there was a lot of push, especially to do that. And over the century, like I kind of mentioned, it's been amended and modified, and the regulations really started to develop. Even like Title 21 really currently in the Code of Federal Regulations. That's the big title right now that kind of handles food, drugs, supplements, different cosmetic medical devices. That's kind of the big one that handles it. That's where it's like the Congress makes all the legislations. That's how the federal government kind of puts it into action. They say, this is what the law says. Here are the regulations that guide what you need to do. And so now we have like the current good manufacturing practices, the different requirements for food, supplements, label laws, all that is kind of built into there.
Okay.
Yeah. And then, and it's developed, and even like the more recent developments, I say recent, kind of what today's standard and regulations for supplements really was based in 1994. That's when the last big push on the kind of supplements, it was the Dietary Supplements Health and Education Act. What that actually did was it really categorized supplements within the federal framework.
Okay.
So beforehand, it was kind of that weird in between of food and drugs. And even as early as the 1970s, there was effort. There were some pushes from the FDA to start regulating specific supplements and specific minerals, or perhaps maybe some hormones or whatever that are out on the market based on potency alone or claims, like what they do. Because, even back then, there's claims of like, oh, this supplement, it would cure your whatever disease or ailment. And the definition of like a drug or pharmaceutical back then is something that is, typically it's a substance that will maybe cure disease, help diagnose or affect something like that. It's there, or it kind of alters a person's form or function. So like it maybe enhances you or do something. And when you and your experience as a physician, when you see a pharmaceutical, you know that there's clear requirements of that pharmaceutical and the testing, what it says, right? And I'm sure you can provide like the good examples of them too.
Yeah, but, it's very stringent, the process.
Yeah. And then what you use
and what you use it for in terms of FDA approved, and there, I will say, once a drug is FDA approved, you can use it, in something that we say is off label, right?
Mm-hmm.
So I would say Ozempic would be a good category of this, right? Your GLP-1, which are like the weight loss drugs that everybody talks about now, right? So, they're marketed for, weight loss, and that's kind of what it's FDA approved for now. But, when people actually started using them originally was for diabetes. And then they found that they helped with weight loss. There were a lot of people originally using them off label for weight loss, right? And then, it started becoming like popular, and then it started being studied more, and then it started being added to in terms
Yeah.
of that the FDA approved it for that as well. But there's, what the FDA has approved, and then there's like off-label uses of medications as well.
Yeah.
So,
But also all those medications, you still need it. Even if it's off-label, you still need it under supervision of a physician, correct?
yes,
Okay, yeah.
absolutely. Mhm.
And so, and I think there was even some regulation because before some of those, like, I think it was in the mid-century is when the laws actually kind of changed to where a lot of these super controlled substances did require prescription from a physician or something like that, a medical practitioner. But even then, like, so pharmaceuticals, even if you use it off-label, it's under the supervision of a practitioner, ideally. Is what you can't just go to Walmart and get Ozempic. I mean, yet, but yeah, maybe so. But yeah, it's very controlled in supplements. But back then, even I think it was in the 70s, Congress passed a law to kind of limit the FDA because the FDA, it was kind of correct, specify that the FDA was trying to say based on potencies or like the amount or something, like maybe you get 1,000% of your daily vitamin C or something. That may not have been an exact one, but there were some efforts to then bring that supplement under the category of a drug, especially if that person was saying that it's going to cure whatever ailment you had.
Yeah.
And back then, Congress indicated that they didn't want it to be that way. So it was kind of amended to where, just because you have a supplement or a dietary supplement that was really concentrated, you couldn't just regulate it. It was still more considered a food. Because again, some of these supplements go back and forth as far as if they're a food or not. And even when you go into fortified, and even you can think of it even like this, like a supplement is a nutritional supplement. It's supplementing your nutrition.
Right.
But that's also when it gets a little tricky because there are brands that do claim that, if you take this, it's going to make XYZ better. And you still got to be very careful about that. You can, to an extent, under the regulations, still claim a form or function improvement, but you still got to be very careful. You cannot say like it will cure your insomnia. That would be
or
way too far.
it's going to cure this cancer, or you're going to become a genius.
Even pharmaceuticals, you can't even say that.
Right.
As you know, it's like it has been studied and proven to treat something. Now you could say it's been treated for it because it's been approved by the FDA, and that's also probably another really big, I guess, delineation between pharmaceuticals and supplements is before a supplement gets released, you kind of mentioned before, the FDA, it goes through a rigorous FDA process and approval.
Yeah.
Supplements don't have to. They're still regulated, but they can come to market without, quote, FDA approval. The FDA doesn't have to look at the formulation, look at the ingredients and say, yes, this is fine. It can come to market anyways. But the FDA does have the right to look at what you're doing, what you're putting in the label and say, you're being dishonest, or this isn't there, or hey, you're not meeting the qualifications of it. Because even in the regulations, there are still what's like good manufacturing practices are mandated, and there's still testing requirements and specification requirements for supplements. So it's not fast and loose. It's actually kind of how it's set up. It's a little, in some ways, it's more, especially from a documentation perspective, more intense than a standard food item. And food is still regulated, and especially depending, and some foods are regulated more heavily and controlled more heavily than others, like meat, poultry, especially because then you got the FDA, but the USDA has a bunch of controls and then inspections on that one, depending on the plant. But like ready-to-eat foods, so there's different categories that may be more intense based on regulatory requirements or history, but it's still like overall how supplements are quality control metrics and how you document everything really started to get recategorized, or maybe it really got redefined, especially back in the dietary supplements, that act in 1994 that Congress passed.
Yeah.
When they did that, that's when they really inserted a lot of the kind of more requirements as far as the different CGMPs and stuff like that, if that makes sense.
Yeah.
So
No, it does.
Cool.
Yeah. So, I think you mentioned, a lot of testing, right?
Yeah.
Because obviously testing is very important. I feel like everybody always talks about third-party testing, and that is always something that I tell patients that they should look for in a bottle, when they're like buying their supplements. But, what role do they actually play in? And, should people actually be aware of them? Is it something that's actually important? What do you think of third-party testing?
I think it's very good, and it's a very good indication of if the person is kind of like following in the lines. And also it's just a good check for the brand itself, or the firm that's doing it, or the manufacturer. And there's a couple different certifications or third-party testing that there is. So you might see something like say CGMP certified. So CGMP means, and I think I mentioned before, but current good manufacturing practices. And that's actually related to federal regulations. The federal law dictates that you have to have your process, like your manufacturing process, has to meet a certain standard.
So I see that all the time, and honestly, I've never understood what it meant. But if it's current good, what else is it? Manufacturing practices. Does that mean literally every supplement has to have that? Like even though they have it on the label? Or
so it would be surprising if I say
and
it would
obviously
be
in
surprising.
the States is what I'm talking
in the
about,
States,
you know, but.
So any manufacturer could get in trouble if they don't have that. Now, and again, third-party testing and certifications, the certification is voluntary. So the minimum requirement is what's in the FDA statutes. And I think it's 21 it's Title 21 and Section 111. I think that's all supplements in the current and the CGMPs are all on that one. If I'm remember correctly, you can check me on that. But that one, so the law itself is actually the minimum.
Okay.
And what will happen though is you could do it on your own and just look at the laws and know that you have your practices good. But a lot of times what a manufacturer may do or choose to do is go to a third party and say, hey, will you look at my process and my facility and how I'm doing business? And would you confirm that I'm following it based on what you understand about the federal regulations as well as anything that you would need and to be associated with your third party label?
Okay.
So, and sometimes the requirements for those labels may be beyond what the federal regulations require. So it may be the base plus a little bit more. So there could be value, especially even branding a value on that. But when you see that on a bottle, it's like, oh, CGMP. Really, that just means that the supplement was made in a facility that has been certified, usually by a third party, to be compliant with the federal regulations on it. And a lot of times it's like equipment that's designed for sanitary processing. So it can actually take food and not adulterate it. You know, it's not made of cast iron. So cast iron would usually, it's not allowed in that.
Right.
Well, not add some iron, but like there's a whole...
It wouldn't add iron. I just assumed cast iron would add iron.
It's that's not what you're worried about. I mean, it could potentially add it, but it's, you know, it could harbor microbial.
Okay.
Like it's very permeable. It can rust. It can add rust to your product, so you don't want that. So that's like usually it's like most everything like standard steel or food grade polymers.
Okay.
When you're doing that, it's got to be clean. There's a whole on the manufacturing side of things and the equipment side of things. There's a whole bunch of set of rules that kind of dictate what is considered to be the current good manufacturing practices as far as how they're manufactured and change. And those change as maybe new technology comes out, maybe new research comes out, but a lot of that can be, that's a whole nother probably podcast to go into itself.
Yeah.
But that just says that the equipment, the facility and how they do business, and maybe like that even covers CGMPs also cover like how you dress and groom yourself.
Okay.
Like the employees have to be to a certain hygienic standard when they're handling that.
So if a label like a supplement is third party tested, they wouldn't necessarily then have to have the CGMP certification as well. But probably if they're third party tested, they would.
I mean, yeah, it depends. So, and again, so the CGMP thing is just, think of it just like how they, like the line, how they made it. It does not touch what the ingredients are.
Okay.
That is a different testing. The CGMP is like, it's made in a facility that is fine. It's like clean. It's a clean facility. It's not, you're not going to accidentally add like some adulterant into the process at the facility. The facility is running clear. The other testing on the supplement side, the ingredient side, that testing is a different certification.
And that's actually testing the supplement
that's
itself.
The
so
ingredient.
the CGMP is more of the manufacturing process.
Exactly.
Whereas third-party testing is testing of the actual supplement.
Yes, the ingredient and the supplement itself. And that's what's good. So it's good that if you see it on a bottle, that's a good thing.
Yeah.
But typically if I was a firm, like if I was running a firm, and I am. But I would not choose to manufacture my supplement or have it be manufactured in a facility that wasn't third-party certified. And you can ask for the certifications and you could check that based off of the certifying organization. And there's several of them that do it. I know like I think like NSF has one. I think I said that correctly. But there's like different third party and international organizations that do have kind of that, not only a recognition and stuff like that. There's a whole plethora of them.
And I mean, just for my clarification, because this is always what I understood and why I thought third-party testing was so important and why I would recommend it to patients when they're buying their supplements to make sure it's third-party tested.
Yeah.
Is that it's like an outside source that's then going to double check that what is supposed to be in this bottle, is actually in this bottle, right?
Yeah.
And like, I feel like it helps keep places honest, right? Because it's not the actual company themselves that's doing it, right?
Yeah.
It's another set of eyes that's verifying this. Would you say that's a correct way to look at that, or?
I think so. I mean, that adds it just adds another level of it. And that's also why you see some supplements that perhaps maybe the ingredients are it's the same active ingredient. Like it's the same citric acid, or it's the same whatever it may be, like vitamin D or E or whatever the supplement that you're looking at. But maybe, and you're wondering, oh, well, what's the difference? And if it's third party tested and they even have it listed, so they're compliant, like Clean Label, NSF, or any of those organizations, that's probably a good indication that they're doing extra testing based off, except for like maybe the minimum. Because again, the FDA does require you to test minimum. They have a whole, like the specifications, it's like, you got to make sure it's identity. I think I have it here, like identity, purity, strength, composition, like all those things are basic requirement, like in the specification of a supplement. So each supplement actually by FDA is required to have a spec that literally lists out like identity. It is what it is. It's the ingredient and the entire product in the ingredient, because you do ingredient testing as they come into the facility. And then on the outside, you're supposed to do some more tests. Typically, you're supposed to do more testing on that part of it.
So to go back to the third-party testing then,
before I get to that.
just to, because I want to make sure that I understand that then. So the third-party testing would be the product at the end, right? Or not always?
No, you do both.
Okay.
You
So
can do both.
if something says third-party testing, though, does that mean for sure that it's tested at the end, or could it just have been third-party testing of what came in the beginning before you actually made the full supplement, right?
It would be hard to say without looking at it and looking at what that organization, that label.
Okay.
I mean, most of them are probably going to say, unless they have a lab that's doing all the relevant tests within their facility, because again, you do the third-party testing because, one, it's another set of eyes, especially if it's an independent organization. If you got an NGO or a nonprofit, that's pretty good. But there's also for-profit labs that do it, and they're still reputable, especially if they're there's a whole nother certification, an organization certification that certifies labs to make sure that they're compliant. So there's like third-party testing under third-party testing and third-party testing.
Okay. So a couple of layers.
So
that's good though. That's good for
like the international standards.
safety.
The International Standards Organization. They have a
that's the ISO one.
ISO. Yeah. Sorry, I may have mentioned ISO, International Standards Organization. A lot of times they're the one that will certify a lab, and they say that the lab is equipped correctly, they're using their stuff correctly, they have like any of the tests that they're doing for the different ingredients or different products, like they have all the stuff there and it's good. And if you're on the brand side of things, when you're kind of selecting things and you're selecting labs, it's very well recommended that you make sure they're listed or certified with ISO, and you can get their certifications and check it back to the organization to make sure that they're still compliant and in good standing before you pick it. So a brand, let's say from a brand perspective, all right, we got labs, we get them tested, and you don't necessarily, they may not show up on the label itself, but let's say you want to put a different, like a label on it. Let's say like, I'll make one up, like the Super Supplements of America brand, whatever. And it's a third party, it's a third party organization, an NGO, a not-for-profit organization that really cares about quality supplements, and they have stringent regulations. You will then do an application to them. You'll show them how you're making your product, the different testings you do, all the ingredients that you have, your label, everything. You give it to them, they'll look it through, and they'll be like, yeah, you're compliant. And you might even maybe submit some of the testing that you're doing. And you're like, yeah, this is good. all your labs check out, whatever. And then they'll say, yeah, you go above and beyond. You meet our requirements to put our label on there because we've double checked your work and said it's good. That's what that label on there means, is that they may be doing it, they may be doing all their labs, but then they give their work to somebody else to review it and they say, yes, I agree, this is good. This meets our standards, which are above. Typically, it's going to be above the base regulation or the minimum.
Right.
And then you could put that label on there and there's marketing rules behind that. But it's to show that, you go above and beyond.
Okay.
So, and I do want to make sure I was clear. And from the FDA standpoint, even as you bring in, I mentioned before the product specification.
Yeah.
That specification, and that's actually where FDA, when they're doing the regulations, usually that's like one of the biggest things most firms, and I say firm brand, it's the person in charge of making the ingredient and distributing it. So you pick up, off the shelf thing at Walmart or whatever. That's like that. That's what I'm talking. That label there, the company that makes it. Yeah. That's it. They may not actually. A lot of times they may partner with other manufacturers or contract manufacturers. So they may be the organization or the business that comes up with the formula. They come up with the specifications and the requirements, but they may contract a third-party manufacturer who then makes it for them. They give them the product and then they sell it and distribute it wherever.
Okay.
Very confusing, but
it is.
But that firm is enough. If you want me to re-say anything, just to be like, go back. But the specification that I'm talking about that the firm has, that will include all the ingredients.
Okay.
And includes what the ingredients are, and you also have to show how you confirm that the ingredients are what you're saying that they are. So you do have to do testing. And by testing, it's like, and there's tons of, depending on what you do, there's different testing for what it is.
So for that testing, to say what it is, that doesn't necessarily though have to be third party tested, right? That could just be that you're verifying it.
Yes.
Okay.
And you want to be able to prove it. It's probably wise, but let's say if you had your own lab that was compliant with FDA rules, and maybe you got ISO certification on your internal lab, you could technically test it yourself and confirm it through a valid scientific means. And again, the FDA requires, usually it's like, they may not say specifically like, oh, for this product, you have to use this test and has to show this results. They give you opening to do it, but you also basically have to prove that, hey, this scientific means, I use this scientific means to prove that the ingredient that I'm putting into my product is what I say it is, and it does meet the other requirement. Like, it's not contaminated. It's the potency. It's the strength. It's the amount that I actually say it is. So you're not getting an ingredient and it's supposed to be 100% ascorbic acid or whatever vitamin C is.
Vitamin C.
Yeah, it's 100% vitamin C or whatever it is, but half of it's
snake oil.
As
like what's going around on Instagram.
Exactly.
I always see your supplements are just snake oil.
You do have to prove.
Well, no,
you have to show. You have to show
testing.
that there is there. And if you don't, the FDA will ding you. And usually they give you opportunity to correct your mistakes. They kind of, because a lot of times I say a lot of times, they give you the opportunity to correct any errors that you made or any deficiencies in how you're running your process or business. So if your specification is deficient or like you just don't have one, they will say you need to correct this. And if you don't correct it, they can escalate and, they can seize the product that you're doing. They can mandate a recall. And if it gets really bad, they can do criminal action. But usually very rarely, it's like from what I've kind of researched and seen, a lot of times they really want you to just correct it and get in compliance before it escalates that bad.
But so just to take an example of if there was a multivitamin, let's just say it had a bunch of B vitamins in it, like a B complex. If you're third party tested, would that technically have to be at the end of that production, what that pill is, that it would have all of those B vitamins, not at the beginning when you were getting them into the facility? It wouldn't have that counts as a third party testing. It would be at the end of the production of the pill.
Yeah, that's what that's my understanding is that you need to do it at the beginning and also at the end. And then you also want to do it at the beginning just because like before you do all this stuff, you want to make sure that it's correct. But at the end, your final product is also what you're getting. If your final product is wrong, and like let's say all your ingredients are good, but in the manufacturing process, they messed up the formulation.
Yeah.
And what your final product is, if that's not exactly what, or if that's not what's on your label, like the ratios are completely off,
Yeah.
then that would be in non-compliance with not only with your specification that you're supposed to provide, but also it's just not. And that's when they will really get you, is because like your label needs to, what you have on your label needs to be what's in your product.
No, and that makes sense, right? Like if you're taking like magnesium or creatine or whatever the supplement is, like you want it to be what it says it is.
Yeah. And
like that can be dangerous, as supplements, or
and,
still have effects. Like that's the whole reason you're taking them, right? But you can overdose on supplements, you can overdose on medicines, right? They need to be the actual strength that they say they are. So yeah.
Yeah. And so and there's certain, and especially just how the labels are and what goes into the labels, that's also where they're different from like normal food, because like food has like a nutritional label where supplements actually have like a supplement label. And they're very similar and they look very similar in many ways when you first glance at them. But when you go through the actual details and the information that's in the supplement and in the label, that's when they kind of diverge, because like a food product, you're going to have the big macros, like the fats, the fiber, the carbohydrates, the protein.
Yeah.
And you also have other major vitamins like vitamin C, vitamin D, iron, calcium, all that stuff. Like that will show up in there in your daily recommended one, which is also the daily recommended like amounts of each vitamin or nutrient. That's actually also pulled from the FDA regulations. That's listed in there. So that's what you base that off of. But supplements, they're going to be, and also calories, nutritional, obviously calories is like the big one. It's up there.
Yeah.
Supplements though, they're going to be formatted a little differently, because you're going to go through, especially all your active ingredients that you have in there. And then you need to specify exactly, like magnesium is a good one. So you might pick up whatever, like magnesium citrate, whatever. And it's going to be like, oh, you have like, I don't know, a gram of magnesium citrate. But you also notice on the side, it will be like, in parentheses, it'll say the amount of elemental magnesium is in that magnesium citrate, because not all of magnesium citrate it's a compound, right? It's like there is an elemental aspect of it, and that's really what you want as a that's what counts. That elemental component of that magnesium citrate is the actual nutrient that you want and that your body wants. And so that number is in what's formulated into your daily value. But that actually but you also lift both. So you lift the total.
Yeah. Which I think is complicated, because you could easily look at a bottle and say, I'm getting 400 milligrams of magnesium. But then the elemental magnesium is
you're
like maybe 50 milligrams or 100,
so like,
could be way less.
I think
that's so complicated.
It's like element, you're
because you don't have that with pharmaceuticals, right? Like your dose is your dose, right? It's not like breaking down in these different.
It's like
elemental
80, right?
Versus
it's 81. It's a baby aspirin. It's 81 milligrams. Yeah, whatever.
Yeah.
Or it's 100. It's whatever is there. So that's very much where it's different. And but you go through like ingredient A, B, and C. This is the amount. This is nutritional amount. So you might have like if it's like citric acid, and also like citric acid or ascorbic acid. Correct me on that. Whichever one's vitamin C.
Ascorbic acid.
Ascorbic acid, correct. So it's just citric acid is very different. Ascorbic acid, but like the type of vitamin C's that you're like even like the type that you get, it will make a difference. So like if it's ascorbic acid, that's another good point. There's different classification. There's also different classifications of ingredients that you can put in a supplement, which then makes it a little more nuanced too. So I think like the first classification, it's like there's class 1, class 2, also fun. So class 1 is more like fortified. They're like fortified ingredients. They're fortified supplements and by that, I mean, it's like derived from like man-made means. It's not from a plant. It's not from a botanical. It's like mind. It's like mind. It's like, I'll pull up magnesium again. A lot of magnesium is actually either mined from the mineral, a specific rock, and then it's processed into the element, into the type of magnesium that you want, or even it's pulled from the ocean, like sea salt or brine or something like that. You pull the magnesium from that source.
Okay.
It's processed, it's manufactured out, and then you have that product. So that's like a class 1 iron. A lot of times is going to be like, you even see that with nutritional stuff. I won't say it's class 1 as far as if it's on a food grade. It's a class 1, class 2, especially for supplements is what I'm talking about.
Okay.
But you see like fortified bread, it has all those minerals and whatever. Well, that's probably not native to
folic acid and all that stuff. Yeah.
Wheat doesn't necessarily have that.
Right.
Like, and the amounts that you're doing, you're adding it to increase the nutritional value of a food product.
Right.
Well, on supplements, kind of like the same situation. So class 1 and class 1 ingredients do require to have 100% of whatever you say is in the stuff. So if it says,
so it has to be very accurate.
it has to be very accurate,
Okay.
because it's like if you say I have 100% of ascorbic acid,
Right.
or I
iron.
have 200 milligrams of ascorbic acid. It has to be 200 milligrams of that.
Yeah.
And it also has to maintain its shelf life over the period of time that you said too. You have to also do shelf life testing. It's fun. But let's say you get a vitamin C from a botanical source, and by botanical, I mean plants.
Yeah.
It's grown, it's botanical. There is a little more wiggle room on that, because since it's biological, it's harder to get exact, like specific, like if you do,
like if you're taking a chamomile pill,
whatever it is.
Yeah.
The ratio is
like
actually
lavender.
They give you a bit more buffer. I think it has to be like at least it's like 80% of what you're listing on there has to be there. If it's a botanical, it's a class 2.
So probably a fair amount falls in that category, because I don't think like even if you're like doing like sulforaphane from like broccoli sprouts or something like
so
that.
There is, and I think part of it is it's harder to scientifically get that accurate part. So it's a little bit harder to do. So they give you a little bit of wiggle room.
Mhm.
But the class 1 fortified stuff, you're like, no, you know exactly. That's like from a really like manufactured source or whatever. It's very easy for us to scientifically confirm it is what it is.
Yeah.
Whereas, and also part of it is like, you're getting it like, vitamin C from like orange juice or whatever you're pulling it from. Not every orange is going to be identical and not going to produce the same amount. And even seasonally, like there's a lot of factors like where it's grown, how it's grown, the weather that year.
Yeah.
Did it get enough water? Like those will all impact the nutrients and the native botanical.
Right.
But then from there on, it's harder. So they give you a little bit more wiggle room on that one. But
Yeah,
it
that
is
makes
supposed to
sense.
still be very close. But you also think about it, if it says 100 milligrams of whatever, but class 2 ingredient, botanical ingredient, even if it's in plus or minus 80%, it's got to be there. But if you're below that, that would be a violation, or that would be something that you shouldn't do. And so you might actually, I'm not saying that, necessarily, you don't know what a brand is doing. And a lot of times the third-party testing might help, because they may say like, oh, you got to shoot high on your ingredient. If you go over what you're saying that you're putting in there, a lot of times, it's not as big of a deal. They care more that you have the minimum and what you say in there, it's got to be. So if you had 101% of the magnesium that you listed in there, you're not going to get in trouble for that. You're actually then just, whatever consumer you're getting is getting a little more extra, which is nice for them. But maybe not as great for your bottom line. So that's kind of there. And that's when there's some good nuance. So like, rose tips or whatever, those are botanicals. And actually another good thing is, and when you come to the label, if you notice and it says like it's from a botanical source, usually you also have to state what part of the plant that you got it from. Rose tips, like leaves, like tea leaf, like whatever extract.
Where the actual source
So,
is from.
the source of it. So it's extracted from tea. Well, the tea leaves is where you got the tea leaf extract, the tea leaf extract. Because, it's got like, the green tea in there, but I did it from the root, which has nothing to do with the actual nutrients that I was looking for. That's also it. It's like, you're looking for this compound, or you got that, you see the botanical and then it's like, oh, it's green tea extract. Well, that has a very complex like chemistry to it and of itself. And this part of those chemistries is what you really want. It's what's beneficial for you.
Mm-hmm.
At least that's what, the claim is.
Yeah.
But again, they're also very complex. And it's also a part of it, the chemistries of it. It's hard to synthesize things without it getting a little thing. So hopefully that didn't muddy the waters.
No,
it's a lot. And
no, it is. Yeah. I mean, honestly, it's kind of reassuring that it's such an involved process.
Oh,
yeah.
And that's also like, it's like, you can actually look on the FDA, website, it's public knowledge. There's a limit to what they say specifically. Usually it's generic, but if you look on there, you could see which firms got a violation, and a lot of times, but that's also like a lot of times you want to look and it's like, oh, in the last 4 months, 5 firms got violated because their standards were poor.
Okay.
That's usually what you see a lot of times. So. And again, and that's not to say that there isn't a nefarious actor out there that's selling stuff, but that's also where, again, back to the original thing that we were talking about, third-party testing.
Yeah.
That's why it could be a very good thing, and could be very reassuring because, the FDA is regulating and in charge of a lot of things. So sometimes what happens is, a firm may be manufacturing, processing, and doing stuff, and maybe it just doesn't get noticed by the FDA. But if it is got a third-party label on there, they have done a bunch of extra steps, and someone else has actively looked at the work. And that's not to say that the FDA isn't doing anything, because they are there. But, you just think of like how much is going on in the United States, how much supplements are sold, all the avenues that you can do online, retail, like all that stuff. It can be very reassuring. I'm not saying that doesn't mean that if a supplement, if it doesn't have like a third-party label on it, that it's trash or nefarious. That's not what that means.
Right. But it's just an extra step,
Yes.
an extra like security.
It is an extra step, an
terms
extra
of-
security. Because again, like all of these third-party labels are voluntary.
Yeah.
You do not, like when it comes to supplements, it's not there. You could still be doing a great job and following all the FDA regulations on your own, but it's harder to say.
Yeah. So, another, I think I read an article, and then also I feel like it's all over Instagram, is people making these claims that all of these supplements have an insane amount of heavy metals in them,
yeah.
and that you're getting poisoned with heavy metals when you're taking supplements. I mean, so do you think every supplement needs to be heavy metal tested? Do you think that's actually true? What do you think of all of those?
Again, it kind of depends on, with all of this stuff, it depends on what it is. It depends on what the ingredient is, where it's sourced.
Okay.
From a consumer, it is a lot harder to see. And you might actually be able to see, like on some supplements, you can actually see a name brand of an ingredient.
Mhm.
Like if it's a specific like magglycinate, or if it's a specific whatever, you could see like, oh, magnesium glycinate, or maybe it's like a vitamin E, whatever. And then on the side of it, it's like, oh, this brand name, it's there. And you go to that brand's website and you can look at all their different things, all their certifications and whatever. So sometimes it's nice to see a brand name on there, because then at least you can track one of the ingredients.
Yeah.
Again, it's still all the same rules, certifications, all that stuff. But for magnesium, probably so, depending on where you're getting it from. Like if you're getting from the ground, if you're getting from whatever the source of that is, it's probably not a bad idea, because maybe heavy metals are, and they're in the ground where you're getting this ingredient from. So you want to do it. But maybe if it's another product, like I go back to vitamin C because I can remember it. So I would have to double check to see what any recommendations on the test. But let's just say that whatever the ingredient is, it's very unlikely that it's to have that concern. You may not want to decide to do that there. Or maybe it doesn't make sense to test for pesticides on a specific ingredient because it's not sourced from anywhere where you would expect pesticides to get to. That doesn't necessarily mean that it can't.
Okay.
Sometimes like a firm, if they want, they can really go more in depth and do a lot of different testings on a lot of different stuff to get there. But you're really only required, and that's another point. The regs really kind of only require you to test for things that is reasonably expectable to be a contaminant from the source, or how it can be contaminated from.
Okay.
So there's like, and it's not black and white. And again, sometimes the regs are vague enough to where it's like, it's up to you to figure it out, and you got to prove it scientifically or have some method.
Yeah.
Sometimes there's very few cases where there's not I can't even think of one off the top of my head. But there's some cases where there's not a good methodology to test or something. And you kind of got to like figure out a way around it. But a lot of times anymore, especially, there's a lot of good tests. I know like the USP is another third party nonprofit. Actually, they were started, United States Pharmacopedia. I probably butchered that last one, but they were founded late 1800s. And actually, they were one of the first organizations in the United States to do for drug testing. They were the ones that, they were actually started by a group of physicians in DC in the late 1800s, like 90, I don't
Yeah.
know, like whatever. You could go to their website and look up their exact history. And
Yeah.
I'm sure that would be accurate. They actually started that, and it was voluntary until the 50s. That drug manufacturers would go to them and take their standards for all their testing of their different ingredients and their processes, because they had tons of standards that they scientifically validated to test for like whatever it is. So you can go to there and get their list of whatever, you're testing for this ingredient. Well, here are the recommended tests that you can do. Here's the science behind it. This is the requirements that you need to get it passed.
Oh, okay.
And that way, if the FDA was like, well, what are your testing you could do? If you pulled the USP and be like, well, I put it there and this is what we did, they'd be like, that's satisfactory.
Yeah.
Because they would recognize that. I think in the 50s
that
even.
makes sense.
I think for pharmaceuticals, I think in the 50s, you can correct me. I think they changed it. I think it got changed by law that like pharmacies, they have to use that they have to be in compliant with those tests for ingredients on that level. And they got different biologics and whatever. Supplements is still voluntary though.
Okay.
So it's not like you have to use their things, but they have it out there.
Yeah.
But that would be a way for you to pull something. But they don't have tests for every single ingredient. So there's still it's still in process because they also take public input.
Yeah.
Sorry, I'm nerding out on this stuff, but they take public input, and so they develop it through different subject matter experts, different organizations like scientists. Like it's a lot of people that actually the public gives input on what should go into it, and then they release it, and then it's usually the industry usually is like, yeah, that's a good example of it.
Well, I mean, no, I think it's very helpful because I think a lot of people, myself included, apart from third-party testing, that was really the only thing that I knew of in terms of recommending what you need for a supplement, at baseline. And I didn't know about half of the requirements that are kind of there.
Yeah.
And then you see some of these supplements will have like 20 million labels on them. And you're like, is that helpful? Are they just like, putting that on there just to put it on there? And so I am curious. So like if on the label it says heavy metal tested, does that mean that it was tested by a third party, or can the producer just test it for the heavy metals and that suffices?
That's all that label, unless you I saw it and it was like, oh, third party tested by this exact organization for heavy metals.
That could be done by just the
It could have been
supplier.
just by them. And again, maybe they could do a great job.
Right. But
especially if their labs got all the tools and it's compliant and certified. But again, yeah, it's I would have to maybe look into that a little deeper, but
I was just curious because it was like something I was thinking about. Like, you get third party testing, but it doesn't necessarily mean that they're testing for heavy metals or like
if they
other
didn't do that, they would get in big trouble for it.
Yeah.
Well, I say big trouble. That would be a violation of their thing, and they'd probably get a letter from the FDA being like, "Hey, you got to prove that you did it."
Well, I mean, I think the idea is that they did it, but it's an extra step. If
I mean, I think
if
if they put it on there, again, I would probably have to.
I was
would
just
have to.
curious.
I would dig into it a little more specific on that one, but I'm very confident that you cannot just blatantly lie on the label, or else that would be a violation. But there may be some gray areas in there that
So heavy
that could
metal
be done.
testing seems like it's kind of something that depends on the supplement, when it's important, when it's not. And same with pesticides, because I think that's something else that can be important depending on what the supplement is, right? If it's more of a botanical that could be out where pesticides
if you
are
see
being
something, if you see a botanical ingredient in there or something from a plant, probably good idea. I would probably, that's nice to test for pesticides.
Yeah, make sure it's on.
And also sometimes even if it's not and doesn't make sense and they tested for anyways, that's not a bad thing. Just because there are cases where for whatever, maybe sometimes your ingredients can get in shipment, they can get cross-contaminated. Not even it's your fault or it's the ingredient manufacturer's fault. Something happens, someone spilled Roundup on the shipping container. I don't know.
Right.
I think that's a big, but there have been instances where there's cross contamination in shipment, or maybe it's fine at a facility, but maybe you get it there's out of the it gets to the facility, it's contaminated, but when it left the ingredients manufacturer, it was fine. So then you can do that. That's a lot more. That's probably less true or rare. I would have to look into that more, but But that could be something that can happen.
Yeah.
That's definitely happened before. So it may still be good to get that tested.
What do you think about like, because sometimes I've also heard of like, so creatine,
Mhm.
some people like swear that you have to get the creatine that's from Germany, sourced from Germany, versus like the creatine that's from China. Like, is
there, again, it's kind of up to you. Now, if it's based out of Germany, you can probably look up. It's probably under European regulate. It's definitely under European manufacturing regulations.
Yeah.
It's the control exports and everything there. Without looking at the requirements from like how China regulates things, I'm not familiar. I'm a little bit more familiar with how the European Union, like I'm a little bit more familiar with their stuff because a lot of our regulations
are similar.
in many ways similar. And a lot of
Yeah.
times Europe, as you may know, is much more stringent.
Yeah.
So they have a lot more stringent requirements. So that may not be a bad idea. I'm not saying that if it's from China or from India or from wherever, it's automatically bad.
Right.
But if it's from Germany, I think it's less likely that there is going to be an issue or there is going to be a miscontamination thing.
Yeah.
And
Interesting. I just,
yeah.
I've heard of it on Instagram and I haven't like really looked
I mean,
into
it's
it. That's
if you're not willing to look in deeply or whatever, it's probably a safer bet. It may be a safer bet. Again, I won't say that, if from other sources it's absolutely true. I don't want to say that, but I do know that Europe has, especially for their food and food regulations, supplement regulations, like just food in general, they have some of the most stringent and controlled standards in the world. So
cool,
especially in the market. That's probably, and again, it can kind of go there, but the U.S. and EU are some of the highest in the world.
Yeah, neat.
I think that's safe to say.
So I guess kind of going into like the next section would really be how, in terms of, and we touched on it a little bit, but like how are supplements actually made? Like what are like the...
Cool. Yeah. So it all kind of starts out with you get a formulation of what you want to make in a supplement.
Mm-hmm.
Maybe let's say like I own my own facility. I have built a facility. It is compliant with good manufacturing practices as outlined by the USDA, or maybe some other third-party testing that I voluntarily have subscribed to. So I have a facility. I know what I want to make. I have the equipment and the systems in line ready to make it.
Mm-hmm.
So I first will find a supplier of the different ingredients that I want, and that also includes anything that has to go into the supplement in order to make it. So there are sometimes like kind of like additives that you have to put into certain ingredients just to make it manufacturable.
Mm-hmm.
Like sometimes like maybe a mineral on iron, you might have to add a food grade, food safe additive on there to make it flow better, or maybe to put into capsule or to do whatever. There are sometimes things that you kind of have to do because otherwise you can't get it into the form you want. But again, all those are also regulated. There's rules about what food grade stuff that you can and cannot do. And you do have to list it on the label. You're also going to source let's say we're doing a capsule. We're doing a supplement. It's got a capsule. It's got 3 ingredients. I've sourced those ingredients. I kind of figured them out, kind of vetted them. They look and feel, they got the good certifications. I get it there. It comes to my facility. And then I'm going to test all the ingredients to triple check. I think you are required to make sure by the FDA that they are what they are.
Okay.
But you could believe whatever the ingredient company said they are. You could believe that if you want.
Okay.
But if it's wrong, it's your fault.
So
that's also another thing. I'm not saying that earlier. I think I may have implied that the FDA makes you test that.
Right.
They're not going to make you test it necessarily.
If it's wrong, then you are.
But if it's wrong, you're on the hook for it.
Yeah.
So you got to prove that it is what it is.
Yeah. Which is good.
So it's good. So it would behoove you, if I was my firm, whatever, my manufacturing facility, I want to go ahead and test it just to double check. All right, it is what I say it is. Yeah. But also, even in the food industry, you might still do some testing like that just to make sure that they're not selling you a bad ingredient.
Yeah.
So let's say you do that. We're a super reputable firm. We're going to do that. We do our testing, we get that online, and then we start staging it. And we'd say all these ingredients can just be mixed together. So we mix it together in some piece of equipment that does the mixing in the ratios we want. So maybe we load it up into like a unloader and it batches a specific amount of the ingredient we need for this product or this batch. So we're making 1,000 1,000-gallon batch or whatever, or 1,000-liter batch of this product. We dose in the exact requirements of it. And again, because as we're going through, the final ratio of that product has to be what's on our label.
Yeah.
We're going to get it in and we're going to homogenize it really well. We're going to make sure that the sample it's all mixed together. Because again, like if you're mixing it and it doesn't mix well, there's like a whole pocket of ingredient B in there.
Mm-hmm.
It's not good distributed. And then in your pills, there may be a whole lot that doesn't have any ingredient B and then one lot that has only ingredient B.
Yeah.
So you're really going to have to mix everything.
Yeah.
And again, you kind of got to, as you're going through your manufacturing process and your specifications, you got to kind of show like, oh yeah, we're going to do this. It works well. And then maybe you want to do as like a manufacturer, you might do some individual testing in between through to make sure that before it gets to the final filling, or the final packaging, that it's still good. So you're going to do there, you're going to mix it. This product doesn't require any extra steps. All this has been done in a sanitary and hygienic environment. So we're not worried about contamination or adulteration of any kind. And then we're going to fill it into our pills or our capsules. And these capsules, they're made out of a food grade, vegan or whatever capsule they are, like cellulose or something like that. I don't know. Also, on your label, you need to put what type of capsule you're using and what it's made out of.
Oh, okay.
That's also true. If you look at your things in there, a lot of times, and I believe that's correct, a lot of times it's going to have like cellulose capsule or vegan.
Nice.
Sometimes it might say vegan, and you can get a certified vegan cellulose capsule, which may be good if it's vegan.
Yeah.
So that also might be a certification that you get it. It's certified vegan, so all your ingredients are vegan. Your process doesn't use or add any animal products. A lot of times those third parties will have the rules how you make it.
Interesting.
It's like magnesium, ascorbic acid, and whatever you're doing. I don't know. Yeah. Like, because, usually some of the, like a mineral is a lot of time going to be pretty easy to make vegan. Iron is, Well, anyways, sorry, moving on. So so you got it in the capsule. Maybe you shake it up. Maybe you do whatever. You get a package, and then you put those capsules into a container. Your specification also needs to list out in that container, like what it's made out of. That won't end up on the label, but you need to record that because the FDA may ask you.
Okay.
And then maybe you put that hygienic, sanitary, sterile little cotton ball on the top of it so it doesn't rattle around and break. Because you also need to make sure that, one, it's just good. It's good for your product and for the consumer experience or whatever. Because if you open a bottle and all the pills are broken, you're gonna be like, oh, like,
why did I
hate
pay all
Why did I
this?
pay for a bunch of whatever? So one, it's good
broken
for the
pills.
consumer experience.
Yeah.
But also you want it in there because you want to protect the pills, because you also want to make sure you maintain the integrity of the product for the shelf life recommendation on there.
Yeah.
You actually do need to do typically a lot of manufacturers and brands will also have to do like shelf life testing to make sure it doesn't degrade over a period of time. Like maybe you seal poorly and there's a lot of moisture in there, and that the moisture can not only degrade the supplement, but potentially could contaminate or adulterate it too.
So
that's kind of but that's kind of going in. You're going through, you're manufacturing it. It's in a pill, and then that can get put in a box and shipped out, maybe direct to consumer, maybe to a fulfillment center, or however you're going to do it.
Okay.
Is there any part of that? That's high level of
no, I like it. That actually like raised a question, because I feel like, for some of like the omega pills and, like the fish stuff, all that sort of stuff, those supplements, sometimes they talk about them going rancid.
Yeah.
So like
that could be it. Yeah.
Yeah. So that end testing, that's more like
The
at
shelf
the
testing.
the shelf testing,
Mhm.
the shelf life testing. That's at the end of production.
Yeah.
Or is it
Well,
like end of production and then also like in a month they test it? Or how does that work?
I'll have to probably look a little bit more into it. But I think it would be a lot of times when you're actually developing and confirming a product, you'll go ahead and do the testing there. And assuming that you're not changing and manufacturing stuff, you may not have to do it as much. But it may still, every now and again, you may go ahead and do like a repeat test just to make sure that all your ingredients, like maybe you change an ingredient supplier and you just want to go ahead and make sure that, maybe the ingredient, it's not really impacting it.
Mm-hmm.
But usually in the development of the product and when you're actually doing the first couple runs, you'll go ahead and do that product testing, the shelf stability product testing. But it may behoove you to do that multiple times throughout the life of the brand or the product.
Okay.
But
It's interesting.
again, it's not like there's not a rule that's like thou shalt do this test every 6 months.
Yeah.
There's not a rule like
Okay.
that in there, if that makes sense.
Yeah. Yeah.
But it is kind of what the firm or the brand is, what their goals are, and what they feel comfortable as far as making sure that they have a good product that is compliant with all applicable federal regulations or local or even state regulations. Sometimes states might also have, that's a good point to also make. Sometimes states might have specific requirements or regulations above what the feds are.
Okay.
Like California is pretty active in a lot of different food and beverage and supplement stuff. So
Okay. Yeah, that makes sense.
without doing any specifics.
Yeah.
So yeah.
So now you also, I think, had already kind of gone into this a little bit, but I think it'd be good to go over it again. So you were saying specs, like in terms of doing like the
Yeah.
specification.
Yeah,
So
yeah,
what is actually, what does that mean? What it is like, if you could just like kind of go into
Yeah.
what that
So
includes.
in the federal regulations, it actually lists out that you are the brand or the manufacturer in charge of the product, or the person who owns the product. Like, let's say like Duration Wellness. We have a product. It is our responsibility to make sure we have a specification that shows that we've looked through and we know how our product is, what it's composed of, what it's being made, how it's gonna, the whole system.
Yeah.
And that if a regulator comes up and asks for it, we can hand it to them and
Okay.
say, like, this is what we're making, this is how we're making it, and this is kind of how we prove that. And the big things that go into, there's like identity. Is it actually what you say it is? It's it's like the right thing. It's like, is that a rose tip? Is it actually rose tip extract?
Yeah.
So identifying the correct thing. Purity, is it like clean? Is it not like, is it actually like, there's not anything else in there? Is that true? Strength is the amount in there. Do you have the amount that you say you have in there per unit? So is it actually, 100% of this ingredient at like 5 milligrams of actual this ingredient? Is that how much is in there? Composition, so you have the composition of it. Doesn't actually, like, let's say at the end of the product, is the composition of that thing that's in the pill isn't actually what you have on the label, and the ratios that you have it on, and the amounts that you have it on. And then I think that the final one is it's not contaminated or adulterated of anything. So, and adulterated means like there's not anything in there that's not supposed to be in there, or even on the life of the product, it's not getting ruined out of unreasonable. Like if it just sits there, like you put it in a package and it sits there and it's fine, it's not gonna go rancid early or not, or there's not any bacteria in there that's not supposed to be in there or stuff like that. That's kind of like some big key parts of it.
Okay.
And you need to have that, and the firm and the manufacturer is supposed to have that documented. But again, and when I listed before, the big things that firms kind of get in trouble for is not having that clearly either made, or maybe it's just not deficient. It's like they're doing it, but they didn't write it down right. That could be it.
Okay.
That could be like they're still making the product. The product could all be fine, and all the testing's fine, but they didn't document it correctly.
Okay. So then the FDA is like, well, you're in trouble. What happens if they just ignore the FDA?
It can escalate. Yeah, I think we mentioned a little bit before, but they could seize your product. They can shut down your manufacturing things if it goes more. There's some more legal stuff that gets involved.
Okay.
I think there can be fines and criminal penalties. I would have to double check. I'm pretty confident on that. But if you just blatantly ignore them, it can escalate. But usually if the firm interacts with them and kind of goes back and forth, a lot of times that can get resolved before it gets bad. Unless it's a severe public health concern, like unless it's like a threat to the public safety or health.
Yeah.
Like you're putting something in there that you're absolutely not supposed to be putting in there.
Right.
A lot of times they give you, if it's an honest mistake or maybe you just need to do a little better, then they'll give you an opportunity to correct it. But if it's something worse, it could get much more severe reaction.
Yeah.
Much quicker.
That makes sense.
Yeah.
So, and then I think kind of the last question would be, there's labels obviously on all of these, and we kind of talked about this a little bit, but like, if you're looking at like a box of crackers, it's going to have like all the nutrition labels and everything like that. And if you look at, a supplement, it also has like a lot of different things on it, right? So, I think kind of going over like the differences in those labels, and also just for supplements, like it seems like you're supposed to be able to trust what is actually on there. But I thought it was interesting too, even talking about how like magnesium, right? Elemental magnesium is different than like the magnesium milligrams that they list,
Or
right?
or
So
the
the
ingredient that they
ingredient,
list,
yeah, that they
like
list versus the
magnesium
actual.
citrate versus elemental magnesium.
Yeah. So I think just kind of going over a little bit of like when you're
Mhm.
looking at this, like what you're actually looking at.
Yeah, so like what actually is in the label itself.
Yeah.
Yeah, so you're right. So and the requirements for what's on the food label. So I think we went over before. Food label. It's you're gonna have all the ingredients. You're gonna have the major nutrients, whatever. But for the supplements label, it's much more geared toward the specific ingredients and also the amounts that you give. So that's when it gets a little bit closer to like maybe how, and that's like when it goes back and forth. It's like it's not a pharmaceutical, but like sometimes, especially how it's branded and acts, it kind of acts more like a pharmaceutical.
Yeah.
That's like the gray area and where people get maybe justifiably so a little more critical of how brands market the products and
Mhm.
stuff. And I'm not saying it's bad or wrong, and it could very well be right. But a big thing is so you need to have the specific active ingredients that you're going to have in there, because a lot of times a supplement brand, it's going to have the reason for it is it's usually claiming some sort of form or function adjustment. Like this is going to help your sleep. This is going to help your athletic performance. This is going to do XYZ. So you have your active ingredients of what they do. And those do need to be listed out in the quantities that you're supposed to have in there. And again, it'll have the daily, if it has a daily recommended value, like a nutritional value, like vitamin C, vitamin D, vitamin E, citric acid, zinc. I said citric acid, zinc, magnesium. We come back to magnesium. It's popular nowadays. There are specific daily recommended values that you're supposed to have in your diet. And that might be the percentage, and sometimes the percentage is more than your daily recommended, like 1,000% of vitamin E or
Yeah.
whatever, something like
Yeah.
that, because that means that is more than what your daily recommended thing is for. So we'll have those there in the elementals, and especially if the compound itself has the ingredient in there or like the element in there, but maybe it's not all of it is. That's where the magnesium citrate comes in. But sometimes you can get like pure forms of ascorbic acid or like something like that. So it literally said that it matches.
Okay.
So you have the daily recommended values of them. That has to be listed. You also get that on nutrition labels, but again, it's more like 30% of your daily protein or your added sugar or whatever. So that's on nutrition. But this one is literally for that ingredient or
Okay.
that target nutrient that you're doing. It's much more specific.
Yeah.
Any other ingredients that are in there that's not active, you also will list that at the bottom. But that's like where your capsule and what your capsule is, and maybe any other like preservative or ingredients that you might have in there to make sure that it's shelf stable. Because maybe some of the stuff might degrade over time if you don't put it in like an oil or something like that. So like you got your
Yeah.
fish oil, it's got the omega-3s, whatever they are, but it's suspended in some sort of oil or whatever it is that's not an active ingredient. That might still be on there, but you
Yeah,
don't
that
have to
kinda
list that
stabilizes
out.
it.
Yeah.
Okay.
Stabilizer, or it may be
So it would be at the bottom.
it would
that-
probably be at the
Yeah,
bottom.
but it
of
wouldn't
what
be in
would
the-
be,
okay.
but it wouldn't have to be in that part of it.
Yeah.
And then what's another good point to make? But yeah, and then like I think we mentioned before the botanicals. Usually, if it's like from a specific part of the plant, you got to list what that specific part is. Like it's from tea leaves, it's from elderberries, like the berry extract,
Okay.
extract of the berries themselves, and
Yeah.
not the elderberry root or something like that.
Yeah.
You got to get specific on where you're extracting it from. And sometimes they'll say like that thing, and then in parentheses it may be like, from its roots or from its leaves or
Okay.
from whatever.
Yeah.
And then also the dosing requirements. So on nutritional labels, they usually do common servings, like, it's 5 servings is 1 patty, or like 1 serving per patty, or whatever it may be. Usually supplements get much more specific. It's like this supplement panel
Yeah.
on the label is 3 capsules, or it's 1 5-gram scoop, or 5 grams. So 5-gram scoop of this is this.
Yeah, that's the serving
That's
size
like the
that will
serving
give
size.
you this
And that's when
amount.
it gets more
Okay.
closer to maybe how pharmaceuticals are, because usually it's like, like 1 tablet per day or whatever.
Right.
And that's kind of where it gets in. So
Is this dose?
that's another thing, is that it's usually very specific,
okay.
like dosing requirements. You might get a bottle of 120 pills, but the serving size is 2 pills, or maybe it's 1, or maybe it's 3. And that is how you kind of will have to adjust it from there. Also, the supplements are going to have, usually they're going to have a disclaimer saying the FDA has not evaluated this to treat or whatever. And usually you can't say like, and usually you'll have something on there saying like, this is not intended to treat, cure, prevent, or whatever. Because again, that's when it's like, if you're going to make those claims, it sounds much more like a pharmaceutical. It sounds more like a drug.
Okay.
So you got to be very careful. But usually you can make a form or function. It's going to support sleep. It's going to support like recovery, or it's going to support brain health or cognitive function.
Okay.
That's a very clear thing that you can make on that. And you can also make some claims on that, like for food, like part of a balanced breakfast, or like it's kind of there, or it's going to like milk helps grow strong bone. Like you can make those claims, form function claims, but you're not supposed to put like it's going to cure your Lyme disease, or I don't know, something like that. Yeah. And that's probably another thing. Because again, like the FDA for a drug, it's going to review something before it goes to market and confirm through its regulations, its standards, or whatever, that it does what it says it does.
Yeah.
A supplement could go to market before that, and then the FDA usually are going to get it for like if it is what you say it is, then it's okay. Usually, it doesn't necessarily like, and even those third-party labels that we mentioned before, a lot of times they're going to mention, it's going to say, it's basically going to confirm that, you know, the ingredients in the product are what they say they are.
Yeah.
And they're not contaminated, and they're free of heavy metals, pesticides, or whatever. But a lot of them do not actually test for like efficacy, or like they're not going to test to make sure that it does what the claim says it's going to do.
Right.
It's not going to test to see, like if you get a third party test, like the Super Supplements of America, third party testing, they're not going to confirm if it actually helps you recover from exercise or whatever, or helps your cognitive ability.
Or helps your hair grow.
Because
or whatever
again,
it's claiming to do.
Because also then it's like, even pharmaceuticals to a degree, they have proof and they have evidence that it does support. And that's not to say that some supplements can't. There aren't evidence out there that these supplements do support that stuff, but it's very different, like efficacy. I think I'm using that. Those claims are very different from what they are. And those labels usually are all, and those testing, it's all to pretty much make sure that it is what you say it is and it's safe.
Yeah.
It's not going to test to see if it actually does what it's implying that it's supposed to do.
Interesting.
And that's probably the biggest thing, I think, when you hear people kind of critiquing supplements and stuff like that, is the marketing and the branding. So that's also why it's important to review the branding and the marketing. I think from a consumer standpoint, if you can, you know, and it's hard to say, but that's something that you can take in mind. It's like, if it's promising the world or whatever, as a consumer, I would maybe be a little hesitant and maybe try to look forward to it. Maybe look for a brand that's more honest. Well, I say honest, I don't know. It's hard to say. But there are some things out there that even you could probably test to, that there's very good research and literature that says that, I don't know, like zinc is really supportive of your immune system. There's a lot of research out there that does support that.
Yeah.
And
or
the
like
medical,
creatine with brain health.
And stuff. So there is stuff out.
Sleep and
So there is stuff out there that does support. So that's probably fine.
Yeah.
But if it's like this super rare root from the Amazon or whatever is going to help
cure everything,
cure eczema or something like that.
Yeah.
Back up. And that's actually, if it gets kind of that, especially if it says cure or whatever, that's usually when some of the regulators will come in and be like, you can't say that. The phrasing of it is very important.
Yeah. So. That makes sense. Well, this is cool. Right? I think that explained a lot. I mean, I found it very interesting. Anything that you think that we missed that we should talk about?
Oh, no. I mean, other than it would spin off into an entirely different podcast, but which maybe we'll do that.
For section 2. Okay.
3A, section 4, on and on and on.
Yeah.
I'm glad that you were patient with me on all this, because I definitely would start. I felt going down rabbit holes. But
no, it's great. I think I learned a lot. So
awesome.
And hopefully everybody here did too. And as always, this is not intended for medical advice. This is just for educational purposes only. But I had a great time on this episode. It was so fun.
Thank you.
And hopefully you guys did too. So
I'm Baby here.
All right. Thanks. Bye.
Bye.
Thank you for joining us for the Duration Wellness Show. We hope you feel equipped to apply today's science-backed insights to your daily life. To find show notes, past episodes, and all the resources we mentioned, visit us at durationwellness.com. As always, this podcast is for informational and educational purposes only and does not constitute medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect those of the host. We'll see you next time, and as always, we're here with you for the duration.